you. Okay, so there was a question about a focused approach. I'll share my screen. This is what I have in the PowerPoint, and I'm thinking that focused and directive are synonyms. So directive, responsive, and hybrid are all different types of intervention approaches that you can use. And I'm thinking that focused is the same as directive in that the adult really leads that intervention in therapy, and it's more focused on like a specific behavior. So the adult has a plan, maybe a child is working on, there's so many things, but maybe they're working on social skills and they're working on like greeting, and responding appropriately, like in social situations. The adult would lead that, and have kind of like a plan and an idea of what they wanted to do, and the child would follow. Whereas responsive, is attempt to encourage child's engagement and provide opportunities for child initiated. So responsive is like, think you're responding to the child's lead. So maybe that same child, if you would use a responsive approach, you would have them come into the therapy room with like a friend or a peer, and you would see how that interaction goes, and then maybe they don't say hi to each other, so then you prompt for that. But it's more child-led. So you're following the child's lead and kind of adapting your therapy to the child. Does that make sense?
Yes, it does.
And I'm almost positive that directive, I'll put it in here, also means focused. Have you guys, I don't know if you guys have a PDF of the book, but like something that really helps is just, and of course it's not working, but just using like the search function. I feel like this has saved me throughout school. And of course it's not working with this book. Some books it doesn't work for, but have you guys ever done that where you search a keyword and it shows you everywhere in the book that it is?
Yes.
Okay. Okay. And of course I don't know why it's not working. Here we go. Here's directive. Okay. Any other questions or things that you guys feel like you need some clarification on?
Failure to maintain weight. Can you explain that? It's
Failure to maintain weight?
Yes.
Yeah. So what is that like kind of under? Is it kind of like the failure to thrive?
It's under, let me look.
I'm seeing if it's in here.
It's under the multiple choice section, so it doesn't really give me a.
Doesn't give you much more than that.
Yeah.
So I would think like failure to maintain weight, maybe knowing like what that could lead to, right, for an infant. So if you have an infant that's born and I'm just going to Google this right now, failure to thrive. I'm thinking it has to do with failure to thrive, where there's like the physical growth of the infant is kind of like stunted or halted. And there's many different reasons for this. Like here's a good chart. Let's see. Okay, so potential etiology. So here's like some reasons, right, and some causes why an infant would be, I guess, like diagnosed as failure to thrive, or I don't know if we call it a diagnosis exactly, but so maybe they're not getting enough calories. Maybe their body is just not absorbing those nutrients and calories and being able to like use them properly. And maybe they have some type of disease or condition where kind of like the same thing with the absorption, like their metabolic demands are higher and they, their body is kind of just out of whack. I would kind of think of these things if she asks a question about that, like, and then what do, if you have an infant that has these issues, like, they can't breastfeed or they have acid reflux and, they can't keep their food down and they're not getting enough calories, like, what is that going to mean for their development, right? Like, we want to make sure that children are getting everything that they need so that they can develop properly. I would think of it like that. And I think as long as you know that much, you'll probably be good. Or
Okay,
like some
thank you.
reasons. Yeah.
And I believe there's a section about the failure to thrive in the chapter that we talked about, like I think feeding and swallowing in the last week, I want to say. That's where I read like a paragraph on the failure to thrive. I don't know if it was like chapter, what is it? I can look it up. We had an assignment last week on like swallowing and
Mhm.
analyzing, and it had it in there.
Here's some feeding and swallowing stuff. I'm not sure what chapter you guys are in. I'd have to go back and see. But yeah, I mean, to be honest, like, I don't think I've ever read every single word in every chapter of any book for school because it's just, there really is so much information, but just scanning and, skimming and like looking at the headings for things is so helpful. And I'm sure you guys do some of this as well, but just in case you like needed a reminder. Um, and then if you do take notes, like just picking out like those most important parts and even just writing them down, like that's all considered studying. And I feel like is kind of an underrated way to study is like, because it takes a lot of time to do that. But I've found that if you keep up on actually understanding the material, then it's not super stressful once midterms and finals come, which I'm sure you guys know already. Are you guys like nervous for this final? Do you feel pretty good about it?
I mean, I feel better about this one than neuro. So
Yeah, neuro. But do you guys have Rivera for neuro?
Yes.
Yes.
She's pretty great, right?
Yes.
We got pretty, I mean, everybody has their own opinions, but we got pretty spoiled, I feel like, in like tries 1 and 2. It just felt like there were so many more lectures. And now that I'm in try 4, there's just not as much, I don't want to say teaching, but there's just not as many lectures. I feel like Dr. Rivera is so passionate about what she does. So it would make me excited to learn the neuro. But yeah, that was some pretty tough stuff for sure. So you guys have neuro, speech sound, early language, and then one more
clinical
class.
practicum 1.
Okay. What are you guys doing in that class?
It's SIMI cases
Mhm.
and then the assignments from residency.
Got it. Okay.
And then there's a couple quizzes.
Yeah, it's definitely, where's my Zoom? It's definitely a lot at first, for sure. You guys got it though. You're here, so that's good.
Raven, what
Other,
trimester are you in?
I'm in trimester 4 right now.
Oh, awesome.
Yeah,
That's exciting.
it is
So it's
exciting.
possible.
It is possible. Yeah, it's totally possible. And honestly, like, it goes by so quick. And I know everyone says that, but I really cannot believe that I only have one more try left after this. And
Mhm.
there's so much information packed into this program, because it is accelerated. I don't think there's
Right.
any other program that's a year and 8 months, but I
Mhm.
would much rather just bang it out and get it done with than be in school for 3 years. I'm also like turning 30 and took time off between undergrad and grad, so
Mhm.
I'm not trying to be like 60 years old. I need to
Yeah.
I need to get the ball rolling.
Yeah. I get you.
Yeah. Any other, I can very easily get on tangents, so back to this. Um, any other questions that you guys have for early language or really any other class? It doesn't matter to me.
I guess I have another question. What is the best
Yeah.
indication or measure of production ratio of number of words?
Say it one more time. The
It says
best
best indicators, and then it's got the hyphen measure of speech production, ratio of number of words.
ratio of number of words. I'm honestly not sure what that's asking.
Here's, I'll post it in the chat.
Okay. Here, let me try to. Oh, good. Wow, I could actually find the chat today. Best indicators slash measures of speech production. Ratio of number of words. Does anyone else have any ideas about this? I'm gonna.
I have no idea. What class is that? Is this for this class?
Yeah, it's for this class. It's in the study
Oh.
guide.
Oh, I haven't got to that part yet.
I think maybe she's talking about the language sample, how we measure the MLU, the WPS and stuff.
Oh,
Remember?
okay,
So
okay.
sugar.
I think, yeah, sugar method. Yeah,
Oh, okay,
that's what
that.
she's
Okay,
referring to, the words, number of words, I think.
okay, okay.
Is that not for SSD? Or is it in this one too?
No, it's in
Well, we did
LD.
the
No, it was
sugar
for
analytic.
ELD, right?
ELD,
That's for
yeah,
ELD.
that's ELD.
Yeah, that's for
Mhm.
ELD. Yeah.
Okay.
Yeah.
I remember that assignment, but yeah, in that case, I have the same question because I was a little confused on that assignment.
What was the sugar assignment for ELD or SSD?
ELD.
ELD. Mhm.
Oh wow.
Because that's the one we're waiting to be graded to finish our
Yes.
signature assignments.
Yes, I remember all this now. And the sugar was probably maybe like the third hardest thing that I've had to do in grad school because I felt like I don't know. I think Iris is on here. I can't see who.
Yes, I am. Yes, hi.
Yeah, and we talked
Mhm.
about the sugar, right?
Mhm.
And yeah, it was definitely hard, but basically just think of this, like just to bring back to the question, like when you're looking at a child's language, there's all these different parts to it, right? It's how many words they're using, it's what kind of words, what kind of errors are they having when they're speaking. So, what kind of things do we use to look at that? I think that's how you can think of it. So, we use language samples and then we use programs like Sugar to help us analyze the language. At my placement that I just got done with at the schools, we used SALT, which sugar is like adapted from salt. It's like a different, way to analyze. And all of that from the sugar assignment will definitely make sense once you're in a school placement and if you do a language sample and analyze the child's language, because you get such good information from just like raw language from a child that you can't get from a standardized test, where they're having to answer in an exact same way and they have to answer it exactly right. So for the best indicator slash measures of speech production, maybe it would be a question like where one of the answers would be, what would you use, to measure the ratio of words? Well, you would use like a language sampler, you would use sugar, things like that. But yeah, that's worded pretty weirdly. Best indicator slash measures of speech production. I'll read something like 20 times and it still won't make sense. I don't know if you guys do that ever.
Yes, and then I have one more and I posted it in the chat.
Speech and language development in deaf and amplification, in deaf children and amplification prognosis. Okay, so when we're thinking of children who are deaf or hard of hearing, what does their speech and language development look like? So if you have a child who has a hearing loss in their left ear and it's a profound hearing loss, and then, they get evaluated and their speech sounds aren't developing at the same rate as their peers, their language isn't being acquired, at the same rate or in the same way. And then they find out, oh, this kid has a hearing loss. And this happens a lot, actually. This has happened twice at my school placement where a kid has passed a hearing screening and then they find out that they actually don't have hearing, and that there was, you know, I don't want to say like a typo, but a mistake. So if you're missing, so we'll take like a child who has perfect hearing in their right ear and then a profound severe hearing loss in their left ear, they're not going to hear all of those speech sounds that they need, right? So it makes sense that they would be behind and they would have, you know, deficits in their speech or language because they're simply just not hearing it. And we know that there's a certain window, I forget the ages, I'm sure it's in the book, where there's a certain window where language, you know, rapidly develops. And if they miss a big part of that window, like what's that going to look like for their language and speech development? And then as far as prognosis just meaning like, what does their future look like? Well, if they don't get hearing aids, if they don't, you know, start getting supports or start learning, you know, sign language, whatever they might choose, then what is that going to do to their speech and language development, right? Like the prognosis is not going to be good if these things aren't addressed, because they'll just continue to fall more and more behind. That's what I'm thinking. And I hope that, like, you know, you never know what kind of questions are going to be on the final, but if you guys have access to your midterm, it's usually the same types of questions, or if you can remember your midterm, usually kind of the same format. I think this one is multiple choice and then some short answer. Is that right?
Short answers and I think case studies.
Okay.
What is case studies?
So you'll have like a description of a client maybe, and then you'll have like maybe 4 questions following that.
Mhm.
That's usually how those case studies go. Any other questions you guys can think of?
Know if this question have been asked or let's see. Like the feeding and swallow differences between pediatric and adults. What would be the best way to, you know, like on a finance to remember, you know, how to differentiate between those?
So it's feeding and swallowing in
Mhm.
children versus adults.
Yes.
See, there's so much with that. And
Mhm.
you're going to take a course on dysphagia, which means swallowing problems,
Mhm.
or maybe just swallowing, I can't remember. There's so much for that. I would see what is in the book, because
Okay.
and I feel like I just passed like a swallowing. So let me see here.
Yeah, you did.
Feeding and swallowing. Okay, they're needed for nutrition, health, and development. We know that. They're
Mhm.
precursors to development of oral communication. Early feeding difficulty may be an indicator of neurological deficits that can result in delays. Okay, so that feels important to know.
Mhm.
Blah, blah, blah. Information about a child's past and current feeding can be helpful in determining their risk. So the SLP is interested in details about their meals, the types of food that they eat, if they have any issues with sucking, chewing, swallowing. So maybe knowing that if a child is having difficulty with feeding and swallowing, that can indicate that there's something
All right,
like
we're
bigger
good.
going on. Go ahead. Sorry, did someone say something that they wanted to add? Okay, I'll keep going. But if you're thinking like in comparison, you know, from children to adults, there's a lot of differences in the swallow, and there's just so much to it. I almost don't even know where to begin. Like, you know, a baby has that suck, swallow, breathe pattern. And like maybe there would be a question on like when that goes away. I don't know if you guys have learned about that. But that might be a better question for Dr. Foy, just because there is so much information. I'm not sure exactly what she would want you guys to know. And you could even like just send an email like, what should I know about blank? Because I'm sure there's more in the book than just this
Okay.
paragraph.
Yeah.
Was that helpful at all? Maybe that
Yeah.
was.
Okay, I'll do that. I'll do that.
There's just so much on feeding and swallowing that
Mhm.
I'm not sure what exactly she would ask.
Yeah, because it just says feeding and swallowing differences between pediatric and adults. So that's all. That's like a case study. It's under the case study.
Right.
Yeah.
Knowing overall that there are many differences in the anatomy, like
Mhm.
there are things that infants have that allow them to breastfeed that of course an adult is not going to have. And things just there's just so many parts. Maybe just ask her. I'm just gonna stop
Okay.
talking.
Okay. I will. I will.
Yeah, just ask her what specifically you should know. And
Right. Okay. Thank you.
yeah. Anything else that anyone can think of? And if not about ELD, we can definitely talk about any other classes. I mean, I don't know how much I'll be able to tell you about neuro off the top of my head, but oh, here's a good chart, guys. This is on page 126 or page 141 if you have the PDF, oral motor development. This is kind of ringing a bell, maybe something about as far as like feeding and swallowing, because that's part of oral motor. But I mean, even just on this chart, there's so much information. The swallowing course was really fun. You guys will like that. Oh, look, and here's even more. Okay, yeah, this is a lot. Anything else? Can you please go over exposure to 2 languages during early language development? Yeah. So I'll just speak like very kind of generally about this. A child being exposed to 2 languages or 3 or 4 or 5 or anything is going to support their language development a ton. Like it's a myth that speaking to a child in 2 different languages is going to like stunt one language, or they're gonna fall behind in their second language. So here we'll just take Spanish and English because that's pretty common, although of course there's a million different languages other than just Spanish. I feel like we always talk about Spanish and English, but yeah, if you work at a school in like a like diverse setting, then you're going to have tons of different languages. But okay, for Spanish and English, so say Spanish is the child's home language, a lot of times the parents will think that by speaking to their child in Spanish that they're not going to acquire English. That's just simply not true. Language, it's in multiple parts of the brain, but all languages, oh, and we got 10 minutes. All languages are in the same areas of the brain, right? There's not like a part for Spanish and then a part for English, as I'm sure you guys know from neuro. So by strengthening one language, you're strengthening the other. That's kind of like the overall to that. I'm thinking of what kind of question would be asked about exposure to 2 languages. It might be pretty general. I don't think that it's going to be something specific. But yeah, just having exposure to different languages. Okay, it's a case study question. I'm not sure how much detail she wants about that. That's another question you could ask Dr. Foy, like, what exactly should we know about exposure to two different languages beyond blah, 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 that it's great and we encourage it. And why do we encourage it? Well, because it fosters language development overall. And that's our goal, right? Good. I'm happy that helps. Yeah, I think like when in doubt, just never be afraid to email any professors any questions. I've asked like questions that maybe somebody else would have thought, are common sense, but that's what we're paying for. And professors honestly love when you reach out to them. I can't say that for every professor, but most professors will notice also, which is good. Good for everybody's grade. Okay, guys, we have 8 minutes left. Anything else? Do you guys feel pretty good about this final? You can have a piece of paper, right? Front and back.
Yeah,
Yeah.
has to be handwritten.
Mhm.
Good. That's a great, I love that.
Mhm.
I wish we could have that on every final, like for neuro. Okay, here's another question. How AAC question looks like as in case study? Like, what are you kind of asking, like what an AAC question would be as far as a case study? Okay. AAC is another topic that you guys will have a class on in Try 4. And there are so many different things that we could talk about with AAC. I mean, obviously knowing what AAC is, right? It's not just an iPad with an app that a kid uses to communicate. It's any way that you are supplementing someone's communication. Supplementing is really not the right word, but like AAC is writing something down on a piece of paper when your throat hurts. Like, so maybe the case study could be like, would you recommend an AAC for this person? The answer is usually yes to that. If they're having any difficulties with their communication or speech. I don't know how specific or I don't really know what you guys have learned about AAC in this class. If anybody wants to speak to that. It says on the study guide, AAC myths and SLP response. Okay, perfect. So let me see if this is on my PowerPoint. So in AAC, oh, here we go. It was on the right slide. What? Okay, forgot about this. Know the 2 types of AAC, and just know this because like you're just going to need it throughout graduate school, aided versus unaided. And I talk about that in the recording. I'm not going to talk about it since we have 5 minutes left. So here's some myths related to AAC. Maybe you're recommending that you have a preschooler and you're recommending that they trial out some different AAC options because they are almost nonverbal and they're speaking, one word, maybe once a day, they're saying a word or two. And the parent says, well, no, I want my child to speak with their words and I want them to use language. That's gonna hinder their speech development. Nope, that's a myth. And let's see, what was it? And SLP response. So we're the experts, right? And like you guys are in Try 1, so like, and I'm not an expert yet either, of course, but our response as the SLP would be to inform the parent, the caregiver, the teacher about AAC and that it supports language and speech development. Here's another myth that children must have a certain set of cognitive skills. So I think the question would probably be like, if a parent or teacher says, This, children must be at a certain age to use AAC. What's our job? Well, our job is to say, nope, that's not true, in a professional way, of course. And, we're the experts in this. So we complete a comprehensive evaluation and we make our recommendations based on our clinical judgment. I don't think the question is going to be that detailed. Okay, it also says aided versus unaided. Okay, so that is on this slide, aided versus unaided. And 3 AAC integration strategies for home or school. So for this one, think how, if you have that child who's a preschooler, and you recommend a PEX board for them, and look this up if you don't know what it is, but it's like a board with, and you guys might know this, you might not, and it has Velcro pictures, and the child can take one off and give it to you. So maybe they want more, they take off the picture that has 2 hands together, for the sign for more, and they hand it to you. How would you integrate that at school? Well, who are they interacting with at school, right? You would need to show the teacher, you would want to model like how to use the AAC with the child. And then at home, like making sure that, you are collaborating with caregivers and parents. What kind of behaviors are they seeing at home? Maybe the kid is throwing themselves on the floor and throwing a tantrum every time they're given milk. Okay, well, maybe that behavior is because they don't want milk, they want juice. So like having conversations with parents and caregivers and making sure that you can teach them how to integrate that AAC into their life. Like, and there's a whole bunch more I could say on that, but I don't think it's going to be that detailed. But know the aided versus unaided and know some examples, which is here. Okay, we have 2 minutes left. Anything else? Maybe I'll stop sharing. Okay, guys, we have a minute left. I hope that was helpful. I will stop this recording.